It was a testing center at Xavier, on Xavier's campus. And what we did, so we weren't sure, honestly, when we were asked to join and help in the efforts, we weren't sure what our role would be. But it truly turned out to being just kind of an advocate for the patient, a place where they can ask questions, whether it be COVID related or just prescription related in general. We provided resources for the patients of where they could receive different information, different prescriptions, how they can receive, so whether it was curbside pickup or a mail order pickup that some pharmacies started to do, so different things like that. So that was more of what we were doing, being a resource. I found that a lot of people just needed someone to listen. They were very stressed, they were very worried, they were very confused about the times and what was going on. And so a lot of times patients would come and sit down and say if they have a question pharmacy related, and it would turn into like a therapy session. But it was beneficial for both of us, for myself as well as the patient. I think that was the most impactful thing. And I think that's one of the things that we find in pharmacy a lot, is just being there for the person and for the patient is more impactful than the medication or whatever they're taking. The person in their holistic sense is much more important. Telemedicine, that's the one word that I can say, is that you found out that a lot of things can be done through telemedicine. So whether that's a clinic visit, whether that's monitoring a patient's blood pressure. And so we learned the value of those things, and really putting the patient's care into their own hands as well. And so I know we have a lot of digital medical centers that are coming up now, where they're sending off like blood pressure cuffs or even glucometers for diabetes, to where the patient can test themselves, and those results get loaded up into the electronic medical record. And so we're able to still see all of those things and really track in real time. So it may be even better than what we were doing before, where we see them every month or every 3 months. Now it was more real-time data, and you're able to contact the patients that are truly urgent to have care as well. So I think that's one of the biggest things, is the impact of telemedicine and the capabilities therein.